Welcome back to the Heart of Medicine. The holidays are upon us, and I am thrilled today to have my dear friend joining me, Angela Buttimer. She's a holistic psychotherapist, and she's here today to help us understand the holiday blues and maybe a few tips to help beat them. Welcome, and thank you for joining us.
Thank you, Dr. Taz. I'm delighted to be here.
Well, we need you. And for many people, the holidays are not the Christmas card greeting that everybody sees.
Right.
So we're hoping you can shed some light on the holiday blues and how to get around them. But before we start, you're a licensed counselor. You're a registered yoga teacher. What got you interested in mindfulness, meditation, and holistic psychotherapy?
Well, I had a calling to be in the healing profession from a very young age. I grew up in a holistic household, so I was exposed to a lot of the self-development, human potential types of concepts and practices. I actually started meditating at age 15.
Wow.
Yes.
I don't think I knew what meditation was at age 15.
It helped me so much, along with journaling, writing, and exercise. I believe that those three practices really saved my life, honestly.
Were you going through personal experiences that led you down that road, or is this just something that naturally evolved?
Now, I did have some difficult times during childhood, and these practices really centered me and grounded me. And now I've been able to go on and witness the transformative results with my clients and patients.
Wonderful. Now, for many of our viewers, they may not understand what holistic psychotherapy is. So shed some light on that. What is that? What does that mean?
Yes. So traditional psychotherapy is generally talk therapy. You come in, you discuss your problems, you problem solve, and I certainly do some of that. But with holistic psychotherapy, we're really looking at the whole person, mind, body, emotions, and so I might incorporate yoga practice or mindfulness practice as a part of someone's healing path and not just rely on talk therapy.
That's fantastic, and I know your work. We've seen it in the practice. We've seen how you made such a difference for so many patients.
Thank you.
Why do you think, because you work with patients that struggle with anxiety or depression or grief, why do you think this becomes an issue around the holidays? What happens right around the holidays where it becomes so much worse?
So the holidays are a time of joy and excitement and connection, and there's a lot of activity, isn't there? So we become, usually in the holidays, overextended, overstimulated.
Too much to do.
Too much to do. And so what happens then is the amygdala in the brain, it's the fear center of the brain, becomes overactivated. And that literally shuts down the executive functioning in the brain. There's an emotional hijacking where people cannot think straight. And I see that with a lot of clients. They feel so overwhelmed they cannot think straight. And so mindfulness can really help us recenter ourselves, ground, and calm ourselves so that we can actually access our best selves.
Is there a group of people that are more at risk? Like, do you think it's women more than men, older women, younger women? What are you seeing usually when it comes to holiday blues?
This is what I see, people who have lost someone.
So true.
Yeah.
So true.
That seems to really peak that experience of loneliness, alienation, depression during the holidays, even for people who are not normally depressed or anxious.
In my early training years, I followed this amazing man who would talk about the anniversaries of grief and how the body and the mind both have a memory. And if you've experienced a loss at a certain point in time, it sort of flares again. So especially I think for patients that have had a loss, you know, right around the holiday time, it can really, really trigger the holiday blues.
Absolutely.
You have some techniques, though, that may help all of us to get through the holiday blues. Share some of those with us and kind of tell us what those look like and how we might need to start incorporating that as the holidays approach.
Sure. So I like to offer different techniques that are simple and accessible because that really gives people a feeling of self-efficacy, that they can influence how they feel, they can influence their moods, and it also improves their immune system functioning. And just that idea of self-efficacy makes people feel better right away.
So taking control of your personal emotional health and being able to shift it and move it forward. That's what you mean by self-efficacy. see.
Exactly.
So give us some examples. I mean, I would
Okay.
love for people watching this to walk away with, hey, this is something I can do. I can do
Sure.
it tomorrow. I can do
Mhm.
it, whenever I need to do it.
Well, one thing I would like to show you is a very brief mini meditation, or what we
Okay.
call a sacred pause. And this can be done anytime, anywhere. And I encourage people to insert sacred pauses throughout their whole day. And so this is called the I Am Here mini meditation.
Okay, and I'm excited about this because I am classic for having a running brain and trying to meditate and noticing that only 30 seconds has gone by and I haven't done a very good job at it. So this is going to be a test for me as well. So
Yes.
let's see what this is.
And you can do this in 30 seconds. So
Okay,
it's wonderful.
fantastic.
Okay. So what I'm going to ask you to do is bring your right hand to your heart and your left hand over your right, and just touch your thumbs together lightly. This in yoga is called Garudasana, or Eagle Mudra. And we're going to close our eyes or avert them to the floor and tilt our chin down just slightly. And just find your breath now. And just notice your breath as it enters and leaves your body. And on that inhale, feel that breath moving up and through the body. And on the exhale, feel that breath moving back down and through the body, exiting through the soles of the feet, entering into the earth's energy, centering and grounding you. Breathing in and breathing out. And on that inhale, say to yourself silently, I am. And on the exhale, say to yourself, here. I am here.
That's amazing.
Thank you.
And that can be
Yeah.
used, I know, anywhere, anytime,
Mhm.
Even when you're shopping, whether you're cooking, whether
Yes.
you're running between gatherings. you
Before
can
everyone arrives.
Exactly, it can be used anywhere. So
Yeah.
that's a great tip. Any other
Yeah.
tips or techniques
Yes.
to help us?
I would love to show you a brief breath work and combine that with a mantra and a mudra.
Okay.
Mantras are just repeating syllables or words. We're going to use some words today. And a mudra is just a seal or a gesture done by the hands that helps elicit a mind, emotional, body state. So today I thought we would use a hand mudra of Hakini, which is just bringing our fingertips together, resting them. Good, just nice, gentle, light touching. And the words that we're going to use today are calm and ease. So on the inhale, we're going to say calm. And on the exhale, we're going to say ease. Now, with the breath, we're going to do something different than we normally do. On the inhale, let's bring that breath all the way into the belly and create a nice big balloon belly. And on the exhale, we're going to bring that belly button all the way to the spine, right? So we're going to do that deep belly breathing, which is yogic breathing.
Yogic breathing.
And
okay.
then breathing in, we'll say calm to ourselves, and breathing out, we'll say ease. So let's try that for a moment.
Okay. So that's classic yoga breathing, which many of us that do yoga or trained in yoga are
Yes.
accustomed to, but we forget to do.
And when we get stressed,
When
we
we're
breathe
stressed.
shallowly, or we actually hold our breath. So just doing 3 rounds of that is going to help someone feel immediately more centered and grounded. I do my yoga throughout the whole day between clients, and it just keeps my body open and relaxed, and I feel like it makes me a better psychotherapist.
I'm sure it does, and that's such a great
Mhm.
point. Even I think I'm guilty of thinking that I've got to do yoga. This is my 30, 45 minutes to do yoga. It's got to be
Yes.
blocked out in the day. But she
Yeah.
makes a wonderful point that this can be throughout the day. You can
Mm.
stop and breathe throughout the day.
Mhm.
You can do the meditations throughout the day. You can
Right.
do yoga throughout the day.
Yeah.
So all of these tips, I hope, help us all beat the holiday blues.
Mm.
Thank you so much for
Thank
joining
you.
us. I hope we
Thank you.
all can use your tips and move forward through the holiday season with happiness and joy. Thanks
Mhm.
for watching The Heart of Medicine.